The operating room had less than 30 seconds before the patient died. Every monitor was screaming. Blood covered the surgical table. The chief surgeon had already called for emergency intervention, but nobody could stop the bleeding. Then the quietest nurse in the room stepped forward, looked at the wound, and performed a procedure that none of the other nurses had ever seen her do before. The bleeding slowed almost instantly. The surgeon stared at her hands in disbelief and asked the question that would expose a secret she had spent 12 years trying to bury. "Who taught you that procedure?" The nurse lowered her eyes, swallowed hard, and whispered only 3 words. "Task Force 160. If you believe people deserve second chances, if you believe kindness can survive even the hardest past, and if you believe that someone's quiet appearance can hide extraordinary courage, please like this video, share it with someone who needs hope, leave a comment, and subscribe to the channel. Because sometimes the person everyone overlooks is the person who has already survived what most people could never imagine." It was 2:17 on a cold Monday morning at Mercy Valley Medical Center in Nashville, Tennessee. Outside, rain struck the windows of the emergency department, and the city lights reflected across the wet streets like broken pieces of glass. Inside, the hospital was running at full capacity. Nurses moved quickly between rooms, doctors reviewed charts under harsh fluorescent lights, and the smell of antiseptic filled every hallway. Among them was a 34-year-old nurse named Claire Bennett. Claire had worked at Mercy Valley for almost 3 years, but most people knew very little about her. She arrived early, left late, never complained, and rarely spoke about her personal life. She had dark brown hair, soft hazel eyes, and a habit of listening more than talking. Younger nurses sometimes assumed she lacked confidence because she didn't fight for attention. What they didn't know was that Claire had learned a long time ago that confidence didn't need to be loud. That night, Claire was assigned to the emergency trauma bay under Chief Surgeon Dr. Nathan Whitmore, a respected physician known throughout Tennessee for his skill and his demanding personality. Nathan was 61 and had spent nearly 4 decades in medicine. He could be intimidating, especially when lives were at stake, but underneath his hard exterior was a man who cared deeply about his patients. His greatest weakness was that he trusted experience more than instinct. He believed procedures had rules, training had levels, and every person had a defined place inside an operating room. Claire was just a nurse. As far as Nathan knew, that was all she had ever been. The emergency began when 3 ambulances arrived within minutes of one another after a highway collision outside Nashville. One patient was a teenage boy with a broken leg. Another was an elderly woman with chest injuries. The third patient was a man named Caleb Morgan, 47 years old, who had been driving a construction vehicle when the accident occurred. Caleb arrived unconscious, pale, and bleeding internally. His blood pressure was collapsing. Nathan immediately ordered the trauma team to prepare for emergency surgery. Claire moved beside the bed, checking the monitors and assisting with 4 access. She noticed something the others missed. Caleb's abdomen was becoming increasingly rigid, and his pulse was weakening in a pattern that told her the internal bleeding was progressing faster than expected. Nathan began directing the team. Everything happened quickly. The nurses prepared equipment, anesthesiology arrived, and the surgical team moved Caleb toward the operating room. Claire stayed at the bedside. She watched the monitor, listened to the changing rhythm of the patient's heart, and remembered something she had spent years trying to forget. A dark helicopter, a desert night, dust covering her face, a young soldier bleeding beneath a damaged vehicle, and a voice telling her not to stop. Claire blinked and pushed the memory away. This was not the place for memories. This was a hospital. This was civilian life. She had promised herself that the past would remain buried. Inside the operating room, everything became chaotic. Caleb's blood pressure dropped dangerously low. Nathan opened the abdomen and immediately discovered massive internal bleeding. The injury was worse than the scans had suggested. A damaged vessel was bleeding rapidly, but the location made access extremely difficult. Nathan attempted to control it, but every movement seemed to make the bleeding worse. The surgical team worked desperately while the anesthesia monitor began sounding continuous alarms. Claire stood on the opposite side of the table, watching. She noticed the angle of the bleeding. She noticed the movement of the tissue. She noticed the way Nathan was trying to reach the vessel. And suddenly, Claire knew exactly what she would have done. But she hesitated. She knew she couldn't reveal what she knew. For 12 years, she had built a quiet life around one simple promise. Never return to that world. Nathan asked for another clamp. Claire handed it to him. The bleeding continued. Caleb's heart rate dropped. Someone announced that his blood pressure was nearly unreadable. Nathan's face tightened. He knew they were seconds away from losing him. Then Claire saw something that made her decision for her. Caleb's hand moved. His fingers curled weakly around the edge of the surgical sheet. He was still fighting. Claire stepped forward. She quietly told Nathan that she had an idea. He looked at her with disbelief. In the middle of a critical operation, he didn't have time for uncertainty. But Claire wasn't uncertain. She knew the risk. She knew the anatomy. More importantly, she knew what would happen if nobody tried. Nathan allowed her to assist. Claire moved with extraordinary precision. Her hands were calm. Her breathing remained steady. She positioned the instruments differently, changed the angle, and instructed Nathan where to place the clamp. The entire team followed her movements because there was no time to question her. For several terrifying seconds, nothing changed. Then the bleeding slowed. The monitor stabilized slightly. Nathan stared at the surgical field. Claire continued. She made another adjustment. The bleeding nearly stopped. Nobody spoke. The room that had been filled with alarms and frantic movement suddenly became quiet. Nathan looked at Claire's hands. He had seen experienced surgeons perform difficult procedures, but the technique she had just used was unfamiliar to him. It wasn't something a standard nursing program would teach. It wasn't something an ordinary emergency nurse would be expected to know. Caleb's blood pressure began rising. The anesthesiologist announced that his rhythm was stabilizing. Nathan finally looked directly at Claire. He asked her where she had learned that procedure. Claire froze. Her hands remained on the table. For 12 years, nobody had asked her that question. She looked at the patient, then at Nathan, then at the people surrounding her. Her voice was barely audible. She said, "Task Force 160. The room became completely silent. Nathan's expression changed. He knew the name. He had heard it before. He understood enough about military aviation history to recognize the significance of the unit Claire had mentioned. But what confused him was the person standing in front of him. The quiet nurse who had spent years taking routine assignments had just demonstrated advanced battlefield trauma knowledge under extreme pressure. Nathan asked who she really was. Claire didn't answer. Instead, she finished helping stabilize Caleb. The surgery continued for another hour. When it finally ended, Caleb was transferred to intensive care alive. Claire stepped into the hallway. Her hands were shaking. She walked into an empty supply room, closed the door, and finally allowed herself to cry. She hadn't cried during the operation. She hadn't cried when she remembered the helicopter. She hadn't cried when Nathan questioned her. But now, alone, the memories came rushing back. 12 years earlier, Claire had not been Claire Bennett. She had been Claire Harper, a combat medical specialist attached to a highly classified military aviation support program. She had served alongside men and women who flew into places where ordinary aircraft couldn't safely operate. She had seen soldiers wounded in situations that never appeared on television. She had learned to work under darkness, pressure, noise, and fear. And she had lost people. Too many people. The worst night had happened during a rescue operation in Afghanistan. The helicopter carrying several members of her team had been forced down during a dangerous mission. Claire had been one of the medical personnel on the ground. She spent hours treating wounded teammates while waiting for extraction. One of them was a young soldier named Matthew Collins. He was 26. He kept asking Claire whether he would see his mother again. Claire promised him he would. He didn't. That promise became the wound she carried for years. After the mission, Claire left the military medical world. She changed her surname. She moved to Tennessee. She became a civilian nurse. She didn't tell anyone about the medals she had received or the lives she had saved. She didn't want admiration. She wanted peace. But the past had found her again. The following morning, Nathan found Claire sitting alone in the hospital chapel. He didn't confront her. He simply sat several seats away. For a while, neither said anything. Then Nathan admitted that his own father had served in the military and had come home carrying memories he never discussed. Nathan explained that he had spent most of his life believing that being strong meant hiding pain. Only after his father died did he understand how wrong that belief had been. Claire finally told him about Matthew. She told him about the promises she couldn't keep. She told him why she had left. She told him she didn't consider herself a hero. Nathan listened. Then he told her something she hadn't expected. He said she had spent 12 years punishing herself for something that wasn't her fault. Claire looked away. She said that she had survived while others hadn't. Nathan told her that survival was not betrayal. It was the reason she was still able to save someone like Caleb. Those words changed something inside her. But the story wasn't over. 3 days later, Caleb woke up. His wife, Sarah Morgan, had been sitting beside his bed every day. When Caleb learned that a nurse had helped save his life, he asked to meet her. Claire didn't want to go. She was afraid. But eventually, she entered his room. Caleb looked at her for several seconds. He couldn't remember everything about the accident, but he remembered seeing her face before losing consciousness. He thanked her. Claire told him she had only done her job. Caleb shook his head. He told her that his father had been a veteran and that his family had always believed the people who save others deserve to know that their sacrifice mattered. Then he reached for her hand. Claire broke down. Not because she was sad, because for the first time in years, someone had thanked her without asking her to be a hero. The hospital staff eventually learned part of Claire's story. Some were amazed. Some were curious. But the people who knew her best simply saw the same Claire they had always known. The nurse who stayed with frightened patients. The woman who brought coffee to exhausted coworkers. The person who never walked past someone crying. Her past hadn't made her special. Her choices had. Nathan later offered Claire a position helping develop trauma response training for the hospital's emergency staff. First, she refused. She didn't want her past turned into a title. But Nathan told her that teaching others wasn't about showing off what she knew. It was about making sure someone else didn't have to learn those lessons the hardest way possible. Claire accepted. Months later, she stood in a training room surrounded by young nurses and emergency physicians. She taught them about remaining calm during crisis. She taught them to notice the patient behind the numbers. She taught them that sometimes the most important thing a medical professional can offer isn't a procedure. It's presence. Before leaving the room that day, one young nurse asked Claire whether she had ever been afraid. Claire smiled. She admitted that she had been terrified many times. Then she explained that courage wasn't the absence of fear. Courage was deciding that someone else's life mattered more than your fear. That evening, Claire returned home and opened the wooden box she had kept hidden for 12 years. Inside were her old photographs, military insignia, and medals. She had avoided looking at them for years. But this time, she didn't close the box. She placed the photographs on the table. She looked at Matthew's face. And for the first time, she allowed herself to remember him without blaming herself. She whispered that she was sorry. Then she whispered that she had finally learned how to live. The next morning, Claire returned to Mercy Valley Medical Center. As she walked through the emergency department, Nathan saw her and smiled. A new emergency patient arrived. A frightened young woman. A terrified father. A room full of uncertainty. Claire walked toward them. Not as a former military specialist. Not as someone with medals. Not as a mysterious woman with a secret past. Just as a nurse. A nurse who understood that sometimes saving a life begins with making someone feel that they are not alone. And that was the real lesson Claire had carried from the battlefield into the hospital. The procedure Nathan remembered was impressive. The secret behind it was fascinating. But neither was the most important part of her story. The most important part was that after everything she had lost, Claire had still chosen kindness. She had still chosen to care. She had still chosen to show up. And sometimes that is the greatest form of courage a person can possess. If this story touched your heart, please take a moment to like the video, share it with someone who needs encouragement, and subscribe for more emotional stories about courage, kindness, second chances, and the people who quietly make a difference. Your support helps these stories reach someone who may be struggling silently right now. And before we end, I have one special request for you. Comment courage is choosing to care if you believe that true heroes don't always wear uniforms or receive medals. Because Claire's story was never really about Task Force 160. It was about what happened after the helicopters disappeared. It was about what happened after the medals were placed inside a box. It was about learning to live after loss. It was about forgiving yourself for surviving. And most importantly, it was about discovering that sometimes the person who thinks their greatest chapter is already over is actually standing at the beginning of their most meaningful one. Claire had once believed that her past was something she needed to hide. Years later, she understood something different. Her past wasn't a prison. It was a lesson. And every life she touched from that day forward became a quiet reminder that even after the darkest night, a person can still choose to become a light for someone else.